So I'm gonna be working empathy. I don't like how I can see. Okay. Yeah, so time I've shown good empathetic skills was um again as my role as a clinical support worker, where this time a patient came in with really severe arthritis and it was in an immense amount of pain. And as I was prepping her for her scan, I could tell that, you know, she was getting a bit upset, and I knew that the more I was going to continue, I was only going to just exacerbate the symptoms even more and the pain even more. So I, in this moment, recognized and understood that this patient kind of needed to take some time, and I asked her that we could take a pause. I asked her whether she had painkillers, and I didn't mind to grab her some water and for her to relax outside for about 20 minutes to wait for them to kick in, and we could try again. And I think in this moment, she kind of thanked me because usually it would have been a case where she'd had to reschedule. And in my mind, I knew that there is no reassurance that I have that her pain is going to get better and that she would come in again. And I wanted her to get that scan at that moment so that whatever they were trying to investigate, they could do it now and she didn't have to put it off and off and off. So I think in that sense, I really understood how important empathy was, because it allows you to appreciate where the patient is coming from, so that you can sort of make adjustments and you can listen to their concerns and address them. And it also plays on like sort of not only the medical side of things, but that psychosocial element where you're not just addressing the disease, the collection of disease, but you're addressing the other things like the mental health, the psychosocial element of things. And I witnessed a doctor show really good empathetic skills when I observed a GP in a consultation. And fast forward to the end, the doctor went into that had a side effect, side effect of weight gain, and the patient became really upset because she had recently been on a weight loss journey. And I just watched the way the doctor kind of pushed himself away from the table and faced the patient so that that the doctor was fully engaged in what he was saying. He leaned in and once again maintained that good eye contact. And I think the patient really started to just kind of voice everything, voice her concerns. And in the end, the doctor prescribed her a different drug, which didn't have such a side effect. And from this whole experience, once again, it just showed that with that, the patient, it wouldn't provide that patient-centered care. And that is important because I'm sure that if the doctor maintained, having that same and didn't really listen to what the patient was saying, she would have used those steroids and it wouldn't have helped treat her condition. But now it helped that patient compliance and adherence as well. I can't remember anything else. I think that's how I would answer the question. Ada omen